Well, colon cancer is on the rise among young adults. A medical expert says colon cancer is preventable if you begin testing at the age of 45 and sometimes even sooner. Our Adriana Gonzalez-Chavez shares what she learned about early screening and what you can expect in this week's Health Aware.
Over the last 20 years, I've been seeing more and more colon cancer.
Dr. Kalyan Chakrala is a gastrointestinal specialist with the Medical Center Hospital, and he says his patients have become younger and younger over the years as colon cancer diagnoses become more common in young adults.
So colon cancer is actually the second leading cause of cancer-related deaths, not just in U.S., but worldwide.
Dr. Chakrala says the best way to prevent colon cancer is to start colon cancer screening at the age of 45.
The insurances will cover everyone now at the age of 45 and older as a preventative checkup. Some patients actually get covered earlier if they're high risk. So if there's a family history of colon cancer, we start at an earlier age. And it depends on how young the first degree relative, like parents or siblings, had their diagnosis of colon cancer. And then we can start sooner, and the insurance companies will cover that.
He also says bad diets with highly processed foods and a lack of fiber-filled foods have been linked to colon cancer causes.
There's a diagnostic and a screening colonoscopy. So with a diagnostic colonoscopy, that's when the patients come in for symptoms, and they have either bleeding or weight loss or other symptoms, and that would be in a different category, whereas preventative checkup would be when they come in for no symptoms at all, or if they have a family history of colon cancer. So that will be covered as a preventative checkup.
If someone is experiencing persistent symptoms of constipation, rectal bleeding, or diarrhea over weeks, it's better to get tested out, he says.
With colonoscopy, we're checking the large intestine. So the entire colon is checked during a colonoscopy, and it's done under light sedation. Most patients are, all patients are going to be kind of comfortable, asleep, and we check for polyps and cancers. So on this next page, you can see there's a polyp right there. And this is a small polyp. We can put a snare and remove the polyp before it turns bigger. And these polyps over time, and colon cancer, the advantage is it's a slow-growing cancer. And over 5 to 10 years, it can actually get much bigger. And a lot of times, when it's big enough, it can cover the entire circumference of the colon and cause a bowel obstruction.
And if you prefer to check for colon cancer at home, there are some options that are also accurate, he says, that will be listed on yourbasin.com. For your Health Aware, I'm Adriana Gonzalez-Chavez.